Straumann Pure, 100% proof tested. I don't even know what that means, but it says it on the box. This is an unboxing video for the Straumann Pure implant, and this is what the box looks like. It's got a little yellow dot on it. I think that's because this is the most narrow implant, the 3.3. First time I placed this implant, it was in a previously failed site from another doctor, and the ridge was very narrow. It was site number 5, and typically I wouldn't think about putting a 3.3 in a premolar site. I guess for all of those out there, that site number 5 would be a 1.4. Anyway, here we go. So the difference between the Straumann Pure implant and an STS or a Ceraroot implant is that, or even Xeramex, is that the abutment portion of this one piece, monolithic Zirconia implant, is that the abutment portion cannot be prepared or should not be prepared or is not approved to be prepared by the dentist chairside with a drill. So this implant requires extreme precision in planning and in execution in order to get a good outcome. So here we go. Oh yeah. What I like about this implant is how they've packaged it. And Straumann's fixture mount transfers have been amazing. So, oh, can you see that thing? Can I get closer? Wow. So the security of the fixture mount transfer is a lot like their Loxam from their titanium system. There it is. Wow. And so this goes in a normal electric driver, or you can also use a regular torque wrench. It's got surface roughness for osseointegration, and then it's got a partial collar, much like has been described of the new renaissance of the hybrid implant with a roughened threaded portion and then a polished collar. Whether you're working with titanium or ceramic, there's huge benefits to that. And then the upper portion is the abutment portion. And you can imagine, if that is not modifiable, this implant really requires extreme care and precision and planning. And yet it's worked very well. And I do like this implant. So shiny, so white, it's so pure.